My name is Libby, but it is.
Upper left corner, there's actually a mute button. It'll turn orange. Hot dog.
Perfect.
There you go. So now we're going to talk about cesarean births. Cesarean is generally not what a mom is going to expect or want going in. But without this, I wouldn't be here. So let's talk about it and so you guys can understand a little bit more. What have you guys heard about cesarean births, also known as C-sections, besides my story?
Anything?
Just what I've seen on television.
Okay.
And if you
Were you
have,
watching Vendor?
if you have had one, you have to have, you can't have a vaginal birth after.
I
Okay.
never read that yet.
Okay. Kitty, do you have anything? Good reason, sorry.
I'm leaving.
2 for 2.
Yeah, I know.
I'm just trying to piss everybody off, you guys, you know.
My friend had one, so she talked about the discomfort a lot afterwards.
Oh, yeah, I heard
Okay.
about that too. Holding a pillow
Yeah,
and
no,
coughing
with-
it
with
out.
the
The twins.
Yeah.
She had to
Everything.
And what are some reasons for C-section?
Well, my friend had twins, so that's why they had to
Okay.
do a C-section for her.
The baby is not in the right position.
Okay. And actually, it's not in the best of place considering where everybody's sitting, but behind you is actually a poster talking about the reasons for C-section. So, I can't really see it for the glare. The first one is an umbilical cord prolapse. This is when the cord came out before the baby. The second one is cephalopelvic disproportion. That means the baby's head is too big. Placental abruption. This is when the placenta separates from the wall of the uterus. We have the fetal malpresentation. The baby in that picture is what we call transverse. And then the last one is placenta previa, which is where the, what is that word? Placenta, there you go, is over the cervix. This is not, definitely not the only reasons that they can do a C-section. But these probably are the most common, okay? And if you look under other indications, multiple gestation is there, so twins.
My nephew's hand was on his head.
Yeah.
So my sister would push, and get there, and then he would go, bloop, pop himself right back out.
So anytime a woman has twins, she has to have C-section?
No.
No.
Oh, okay.
And honestly, you do not always have to have a C-section. If you've had one, you can have what's called a VBAC or a vaginal birth after cesarean.
Really?
Depending on the circumstances, yes.
Mm.
We're gonna talk.
Yes, we're getting to that. What are some reasons for a C-section? Well, we just talked about that, never mind. So, this is kind of what a C-section is going to look like, okay? The mom is going to have an IV. Her arms are going to be out to her side and tied down, usually. Her legs will be tied down as well. There will be a curtain, and behind the curtain is a sterile field, so nobody can touch around there because we don't want mom or baby to have an infection. There will be a few medical professionals at mom's head, at the very least the anesthesiologist who's monitoring mom's vital signs and making sure she's comfortable, and if she gets sick, he has medication that he can give. There will be at least 3 people actually doing the surgery. There's your head doctor, the assistant doctor, and then there's the scrub person, the surgical tech, who is in charge of all the stuff. You're also going to have at least 2 nurses in there who are going to take care of the baby after delivery. The reasons: fetal intolerance. If the baby's heart rate is not doing what it needs to do, well, we have to get the baby out. The head is too big, I've got cephalopelvic disproportion. Failure to progress. I got to 5 centimeters, but I never got any further. Breech presentation, meaning the baby's upside down. Placenta previa we talked about. Prolapse cord. Abrupto placenta, which abrupto means it separates, whereas placenta previa means it's over the cervix. Maternal disease. Mom's blood pressure is way too high. Mom has something like active herpes lesions. Mom is HIV positive. These can all be reasons why they have to do a C-section. Previous C-sections is definitely a reason to do another C-section. Now, how they cut the uterus is what matters. So if I'm standing up and they cut my uterus top to bottom, that would be a reason for you to never be able to have another vaginal delivery. But if you have that vertical cut, this is vertical, horizontal cut. I knew as soon as I said it was wrong. Have the horizontal cut, then yes, you do have the potential to have another VBAC or vaginal birth after delivery. Oh, it went fast. Some women may be eligible for the VBAC. It just depends. If you had a C-section in California and then moved to Florida, they're probably not going to want to do a VBAC because the doctor who's delivering you here cannot be 100% sure what your uterine scar looks like. And even if you have that horizontal cut outside, does not mean you don't have a vertical cut inside. It's really important to understand
So
that.
what are they afraid of? It like tearing
Yeah,
or something? Okay.
Because the top of the uterus is where all of the work comes from.
Mhm.
So yes, rupturing or opening, yes, is the big thing. Ways to avoid a C-section. Choose your doctor or midwife carefully. Your doctor gets paid more when you get a C-section. And some people are unscrupulous and are going to try to get you to have a C-section just because they want the money. That's-
Scumbags.
Okay, well, I can't argue with you, but that is the case.
Yeah.
Ask questions and explore all your options. Okay, you guys, we have 3 hospitals here in the county. Which one has the lowest C-section rate? I don't know, but that could be something that you could look into. Now, I will, having said that, say to you, your doctor goes to one because they all do. So if you want to stay with your doctor and at this stage of pregnancy you have to, that's the hospital you're going to. Consider getting a doula. We talked about doulas in the first class, I believe it was. So there's the labor doula, there's the postpartum doula, the breastfeeding doula. And this will definitely lower your chance of C-section by about 50%. Remain at home until your labor is well established. We talked about the 5-1-1, 5 minutes apart, lasting for 1 minute, this happening for an hour. If you go in very early labor, then they're like, oh, let's give you a little Pitocin to get you going. Oh, your blood pressure's low. Oh, the contractions hurt a lot. Let's do your epidural. Oh, look here. Look, okay, well, we're going for C-section. One intervention will turn into 5 very quickly. So we talked about 5-1-1. And ask your provider. If your situation is different, entendre. If you I said it right. I'm excited. For you, having had 5 previous babies, your doctor may say, well, 5-1-1 for you, that's going to be a little bit too soon. Because they're expecting you to go through labor at a much faster pace. So your doctor may say, I want you to come in at 7 minutes apart. Okay, so we definitely want you to have that conversation with your doctor. Utilization of non-medical methods for pain relief. Well, if you don't have that epidural, you're going to have a lower chance of a C-section. It's not a 0 chance, but a lower chance. The use of walking around and moving frequently can help progress the labor. We talked about when we were doing that rocking or that dancing, that we're pushing that baby's head against all those bones. That's going to help the baby come through. If you're just laying in the bed, what's helping that baby come down and come through? A thorough yet flexible birth plan. Birth plans are on the agenda for today, but what do you want? Have you thought about what labor is going to be like? Have you thought about all your options? Have you thought about having that really good support person with you who's going to have your back and tell the nurse, don't say anything about epidurals, we know they're available, we'll tell you if we want them. Mother should stay well nourished, well hydrated, and well rested during the last weeks of pregnancy and throughout labor. It's hard when you go to the hospital and have a hospital birth. They don't want you eating. They really don't want you having anything but ice chips. So stay well hydrated. Eat right before you go to the hospital, honestly, unless you know you're having a C-section. I would have something kind of healthy.
And find out, I know when I was at Shands doing my observation a couple of weeks ago, they gave the moms popsicles instead of, so they were actually giving them something that had
Some nutrition.
flavor.
Mhm. And again, it depends on the policies of your hospital. Some hospitals are going to say no. So your choice of anesthesia, you have your spinal or epidural anesthesia. Remember, the difference is the epidural leaves that little tube in. The advantage is the mother can be awake, can see the birth. She can touch the baby, not really hold it after delivery, but touch the baby. In most cases, dad can be present. So they're gonna, while we're having an issue, we're gonna go back. This is why they don't want to wait until it's an emergency. Okay. You may not feel too groggy. No, you may not feel groggy, nauseated, or vomited. That's not true. You probably will feel nausea and vomiting whenever they're pulling the baby out because they actually have to push the baby into the stomach to get it out. So most moms are going to feel nausea and vomiting. Did you feel that?
No, because they gave me Finnegan to numb my stomach.
Then they do that as well.
With Libby, not Micah. Which is funny because the one that I threw up on is the one they gave me the stuff to numb my stomach.
Takes longer to give, cannot be used in an emergency situation. Okay. General anesthesia. Fast form of anesthesia, mother may be asleep and not aware. And this is good for mothers who are terrified or not wanting to know. That happens as well. Disadvantages, you're not going to be awake for the birth. The support person is not going to be there. If the only reason to have the dad in the room or the support person is to keep mom calm. Delays in early bonding and first breastfeeding, slow recovery, painful recovery. So what they're going to do, unless it's an absolute emergency, they're going to come in and they're going to say to you, you've been in labor for 24 hours. Your baby's heart tracing is not exactly where we want it to be. It's been long enough, you've tried, let's go to the C-section. So they're going to ask you to sign the consent form. They're going to put in your IV and your catheter if you haven't already had them. The mother's usually asked to drink the medication to calm the stomach, antacids. Many women are given an epidural, although in some cases you are going to get a spinal. General anesthesia is rare. The reason they don't want to do that is because all the meds that put you to sleep go straight to the baby. So they really don't want to do that. Anesthesia provider will check with you to make sure you're comfortable. You will only feel pressure and not pain from the waist down. Oxygen is given by usually the nasal cannula, that's the one in your nose. Mother's secured to the operating table. Yes, your arms and legs are tied down. An automatic blood pressure cuff is put on. You're going to have the pulse oximeter on your finger. You're going to have the heart monitors, so all the little stickers all over your chest to help monitor your heart. Your abdomen and upper pubic area are shaved and then washed with betadine. Betadine is extremely cold, and that's the stuff that's actually going to stain your skin brown or reddish brown for a couple of days afterwards. The sterile drapes are put up, and it's going to cover both your abdomen, and then there'll be a second one that goes between your head and your abdomen. The drape is raised like a curtain, so you can't see it. I guess I should just read it. There's also going to be one with an opening around your abdomen. That one actually has almost a bowl-shaped area in it that goes on your legs, so that when they do the surgery and your bag of water breaks, it goes into the bowl, and they don't have a mess all over the operating room. The support person sits behind the mother's head and is also behind the curtain or drape. Yes, the answer is you can peek if you're not squeamish. If you're squeamish, dear God, don't peek. Just saying.
We are not picking you up off the floor, Chris.
Well, they will eventually.
They won't be there until they're done, though.
Yep, they will eventually check on you. And actually, Shands has a daddy emergency. There's a clipboard up on the thing that says daddy emergency. So if dad takes a nosedive, they're going to get that out. But I promise you, mom and baby first.
We will shame you, though.
Well, I'm not squeamish, but I am hoping we don't have to get a C-section.
It happens in vaginal deliveries as well, especially if you're not taking care of yourself. So you do have to eat when she's in labor and the like. It allows you to see without too much effort. There's going to be people in the operating room, the surgeon, the surgical assistant who's also a doctor, the anesthesiologist, also a doctor, your scrub nurse, your circulating nurse, designated person to care for the infant, such as the nurse or pediatrician. Really, they're going to have a pediatrician there only if they're really worried that there's something wrong with the baby or the baby's heart tracing has been really bad. And they're not talking about the surgical, the scrub nurse. No, what did I just say? The surgical tech who takes care of counting all the stuff. So they didn't mention that, but that person will be there as well. In most instances, the incision is transverse, meaning the horizontal cut. Really, they're only going to do that vertical cut if there's an emergency, like minutes or hours kind of deal. Actual surgery takes approximately 1 hour, and most surgeons can go from skin to baby in 1 minute. It takes a lot more time to put you back together. After the first incision, the baby is born within minutes. The baby's dried section and given the care in the warmer. The operating room is very cold, so they have to really worry the baby gets too cold. You will be freezing, I promise. If the baby needs special attention, they may be transferred to the nursery before your surgery is done. So if there is an issue, the NICU doctor, whoever will come in, they will take the baby to the next room. The baby can even be transferred right away, even before your surgery is done, depending on your situation. If the mom and baby are stable, the baby will be brought to the mother to see and touch. We're not really to the point where you're going to get skin to skin in the operating room here yet, but the baby will be wrapped up, and Crystal will probably be given the baby Okay, you'd be able, or Tandra, you'd be able to touch the baby and kiss the baby, but they will not let you hold the baby in the OR just because of all the meds they're giving you. They don't want the baby dropped. The baby's father or support person may be able to hold the infant. And once the baby's on the warmer, you may actually be able to cut the cord as well. If the mother's given prior informed consent and desires to have her tubes tied, that can easily be performed at the birth and before the incision is closed. This isn't in here, but I want to prepare the support people. To fix the uterus, sometimes they actually take it out of the body. So if they do that, don't freak, it's okay.
We still need that.
Well, they take it out, they check it, they've got to sew it back up. Look on your face.
Are you gonna put your placenta on the wall?
I was I was like, can you
Eat
say
it,
it aloud?
eat it,
You do not want a cesarean hysterectomy.
I just didn't want to have to have a period anymore. I was just like, take it out.
You do, because the reason that we get postpartum is we go from pregnancy hormones to nothing.
Right.
To no pregnancy hormones. To go from pregnancy hormones to no female hormones?
Oh, yeah.
Good girl. You do not want that, I promise.
Oh, I was just being funny.
Okay, good. You
You
don't
know
want
me
that.
joking.
I would totally say the same thing
Like-
though. I'd be like,
I was-
while you're in there, you might as well just take it off.
I was
I'm
asking
done.
them to do liposuction and tummy tuck.
Yeah, and that's fine. Just understand. Go
Like
ahead.
a week and a half ago, she looked at me like she was getting ready or something. And she's like, "Ugh, I'm gonna have a period again soon."
No, word.
I was like the last time when he was asking me, he's like, "Are you sure you want me to do your tubal?" And I was like, "No." I was like, "I don't want you to do that." And he's like, "Are you sure?" He must have asked me 15 times. He's like, "Last chance," and I was like, "No." We had fun.
And Chris, having never had one, you just don't understand.
Oh no, I see what she goes through, and I know it's awful. I know that I don't understand, but I know that it's awful.
Especially with endometriosis.
Yeah,
Yeah.
it sucks.
Especially.
It's painful.
It's
so
so
painful.
Yeah. The surgical incision is closed with surgical staples, sutures, or glue, and covered with a bandage. Mother's taken the recovery room for careful monitoring for about an hour. Can be longer, can be shorter. I would ask that the baby be given to you immediately as possible. I do know at least a couple of our hospitals will allow the baby to go to mom in the recovery room. If everything is stable, this is when you might try to do your skin to skin. The 9 steps, the baby should still be wanting to do them. Okay. And depending on the hospital, the baby may be given to you in the recovery room, which I
You're
said.
usually in the recovery room until you can move your hips or your toes. Once you start getting the movement back in your limbs.
And usually only one person is allowed in the operating room, so you have to, part of your birth plan, who goes to the OR with you. And that might be really hard if you're talking. And that's what I was gonna say, if you're talking your husband or your mom, for instance, or in your case,
Your care coordinator, your husband.
yeah,
Care coordinator, girl.
yeah.
Girl power.
I'll throw mess with you for
Well, Pokemon battle.
it.
Oh God.
Seriously, I'm gonna need new people.
I'm available as well, and I'll even call you.
And you
Kate.
don't play Pokemon.
Yeah, no. And I promise you know what? We'll go with you because we
Okay.
don't play, right?
That part.
Okay. So, yes, it'll just be us. For the baby, since the baby did not get pushed out through the birth canal, the baby did not get that big squeeze, which gets all the amniotic fluid out of their lungs. So, the baby may have some leftover fluid. This could be a reason that they end up going to the special care nursery. And to make sure that that does get reabsorbed. It's not the end of the world if they have it, but you're not going to have the baby in the recovery room. The baby will be in the nursery. It's possible that it could cause them to have a little pneumonia as well. It's possible that it could lead to some issues. And the APGAR score, of course, if the baby's not breathing right, it's not going to be great. Okay. Due to this, some C-section babies are monitored more closely for a period of time. There's usually a 3-day hospital stay, and activity will begin as soon as the anesthesia wears off. So as soon as they think your epidural or your spinal is worn off, I promise you, you will be walking around the hallway. And they will not be friendly about it. Get up and go.
As soon as they take that catheter out.
Yep. With help at first, this is not going to be fun. It will hurt. But movement prevents, the big one is pneumonia. blood clots, gas pain. Yeah. Diet is going to be liquids at first, just to make sure that your stomach is awake again and to make sure that you're able to tolerate it again. This was an abdominal surgery. Exercise, well, easily to begin with. Just move your legs a little bit, get some movement in them. Pump your ankles, and deep breaths and coughing prevent pneumonia. They have that, what they call incentive spirometer, where you suck in and the ball goes up. Yep, use it for at least a week. Gentle abdominal tensing, this is just kind of working those muscles as tolerated as your doctor wants you. And Kegels, definitely really important. We don't want to have urinary issues later on. Breastfeeding. Breastfeeding will be a little bit more tricky because you're going to have that surgical incision in your abdomen. So you may only be able to football hold the baby, because if you lay the baby across, it puts too much pressure on your incision. But you may start as soon as the baby's able, as soon as you're able. Breastfeeding requires the muscle to squeeze the alveoli to make the milk come out. So those muscles have to wake up as well. Usually the kind of pain medication they're going to give you is compatible with breastfeeding. So you just want to make sure your doctor knows your plan. Seek different positions for comfort. This is both in sitting and in breastfeeding. Well, this is all breastfeeding. Ask for help. Okay, it may be that your regular boppy is too tight on your stomach and you need the big twin breastfeeding pillow for comfort. They're just wider. Okay. What does the support person do? Number one, understand why this is happening. Mom's going to be so totally emotional. She's gone through, in Virginia's case, 15 hours of labor. And then, oh my goodness, I didn't want the C-section. Now I have to go for it. And she may forget the reason. But Katie, the baby's heart rate isn't where it needs to be. The baby isn't safe. Okay. Explain it to the mother. You may have to explain it over and over again. Lots of reassurance. It's okay. The baby's going to be okay, especially if it's an emergency situation. Remind the mother that the results are the same. Healthy baby. Remember that you may be separated from her both before and after the surgery, which can be really hard for you. During, you're going to sit at her head, reassure her. Try not to watch the surgery as much as possible. I saw that, Chris. You should hold the baby as soon as possible. Remember, the baby, we saw the 9 steps, wants to be with you, wants to bond with you. So, oh, the baby's okay, let me, spend a little minute with my wife, is a good thing for your relationship, but is that the best thing for the baby? And go with the baby to the nursery. Depending on the hospital, you may not be allowed in the recovery room. So if you can't be with Katie, get the baby, let the baby bond with you. Just depends on the situation. Afterwards, as soon as possible, can the baby go to the mom? Can we go to my wife? Is the baby okay? Is my wife okay? Let's put them together. We really want to breastfeed. You may have to not be pushy or jerky, but hey, my wife wants to breastfeed. Can we go ahead and get the baby to her mom? And they'll pull the baby's blood sugar's low. It has to have formula. Well, why can't she go to her mom? Or I'm saying she. I don't know. Just saying. Stay with the mom and baby in the recovery room as much as possible. Again, don't leave her alone. She just had major surgery. She just had a baby. The baby's going to be wiggling and squirming. And is she really tired or really out of it and can't hold the baby correctly? Don't leave her alone. Consider the mother's feelings before allowing everybody in. Okay. Family is the best and worst part of having a baby. Because, and I've done it myself. Oh my God, my brother just had a baby. That's my nephew. Give it here. But is that the best thing for bonding? Is that the best thing for breastfeeding? And I'm not saying that anybody is being wrong or ugly or anything like that. You have to protect the mother-baby bond, okay? And if possible, only the mom holds the baby for the first 4 hours.
The thing I wanted to say about this too is I had a friend of mine who had her baby via C-section. It was unexpected, and it was at Monroe, and at the time they didn't let you see the baby. So she actually did not get to see her baby till after her recovery period. And the mother-in-law wanted to see the baby right then and there, so her husband, of course, let her. And she, to this day, resents that mother-in-law because she was so pushy about seeing the baby. And she's like, I didn't even get to see my baby first.
Yep.
So just keep that in mind, too.
I would kill her.
If my mom wasn't 1,300 miles away.
Oh,
I just want to
my
put
brother's
that out
mother-in-law
there,
would be
too.
like that.
Yes.
Oh my
So,
goodness.
You know, that's why I put that up there. I mean, he didn't think anything of it. He's like, yeah, okay, yeah, sure, let's go see the baby. He didn't think of how she would
Right.
feel.
Right.
Right. And
Surprised
you know,
he made it.
I had a client call me and say I'm having trouble breastfeeding, so I went to the hospital. She was 16, and the baby was an hour and a half old, and everybody in that room, and there were 20 of them in there, had held that baby, and she had not. And I'm like, okay, first things first, everybody out, okay? So think about it this way. We're gonna breastfeed. This is a private part of our body. Let's whip it out in front of 20 people and try to latch the baby on?
Right.
No. Absolutely not. Breastfeeding is going to be very difficult
Yeah, you
to
say
begin
that
with.
for Target people. Come on.
Yeah, exactly.
And I try to tell people anyways, you're only going to be in the hospital, what, maybe 3 days tops,
Yep.
especially if everything goes fine. Tell them you can come see the baby when we get home.
Yep.
Family's waited 8 years. They can wait another couple days.
Yes.
Well, when we told her that they might take us a couple weeks early, she goes, "You want me to change my flight and come a little early?"
We're
I'm
like,
no.
no.
I'm like, keep it where it is. She's
Nope.
like, okay.
Because you can use that help whenever he goes back to work.
Yep, absolutely. And you're still going to be healing. Some women may schedule their C-section out of convenience.